Okay, what's up guys? Today I got something special for you guys and I think you guys will like this. Today I'm going to talk about lower back pain, and that's a problem that is so common among lifters and both non-lifters alike. Okay, so today I'm going to go through how to solve that problem once and for all, and I promise this will definitely help you, whether it's going to completely eradicate that problem for you or it's just going to relieve that pain a little bit. Okay, but first a medical disclaimer. Okay, I'm not a professional, or yet I'm not professional, and do not take this as medical advice. So if you still need help for your lower back pain, please seek medical advice for this. Okay, but with that, let's start the video. Today I got my friend with me and you guys will see him in a second. Alright, but he'll be joining me and he is going to be my patient for today, and I'm going to try to help him solve his lower back pain, which he's been suffering from for weeks, months, I don't know.
Years, bro.
Years. Okay, so without further ado, let's go. Okay, so today to tackle Dylan's back pain, we're going to tackle the problem from 3 different angles. Okay, so back pain can be contributed firstly from obviously your lower back itself, so this part. Alright, then the second part, it will be caused by your glute medius, which is your basically your ass, but a small portion of it right here. The last one, alright, is actually a part that most people don't think that it will cause a problem, and that is your hip flexors. So your hip flexors is right here, and what it does is actually it helps you to raise your leg. So if you come up, you bring up your knee like this, that muscle there, so when you bring up your knee and you put your hand here and you feel that you can put your leg now, and that muscle there, that's the one that is causing your back pain. And that's quite surprising for a lot of people, because they think that's in front, what's it going to do with my back? But it's actually all really interconnected, trust me on this. Okay, so first we're going to tackle his lower back, and we're going to address these problems with 2 main modalities. Okay, the first one is manual pressure. We're going to be exerting some pressure onto the muscle. The second one is stretching the muscle. So we're going to be starting with pressing his lower back. Okay, so we're first going to apply some pressure onto the lower back. Now I want to show you guys exactly where and how to apply the pressure, because applied at the wrong place you can actually injure yourself. So I'm going to bring the camera over. Okay, so I'm going to lift off your shirt, and if this is the start of the hip, okay, so this is the hip line, and then this is where the lower back muscle starts. So you can actually feel the bones of the hip here. Don't be pressing on here, this is going to hurt whoever you're doing this for. If you're doing this on yourself, then it's going to really hurt. But if you come up just a little bit, okay, this is where the lower back muscles start, and this is where it's going to hurt. Okay, so let me secure the camera and I'm going to show you guys how to apply some manual pressure. Okay, so we're going to start out by just using the elbow here. Alright, so remember, find the bone and goes above it. Alright, then I want you guys to find the spine, okay, so which is right in the center, and I want you guys to completely avoid that. Okay, don't be pressing down the spine, because that will really hurt and it could cause injury. So from the spine, go just outside, lateral to it. Okay, you can put down, so you can feel for it, and where the meaty mound is, you're going to use your elbow and just use your body weight and press down. So start out by just pressing down and not moving at all. Okay, just let the person get used to it. And this manual therapy, I mean, even if you go to a physiotherapist, they will do something similar for you. But of course, this is more for people who can't really go and afford a physiotherapist and go have physiotherapy sessions. So, but if you can afford one, please by all means go for physiotherapy. Okay, so I'm still on the same spot. As you can see, I'm still holding it here, and I'm putting about less than half of my body weight on it. I'm not really pressing very hard. So now I'm going to move up, and then making sure not to press the spine, and I'm pressing down. Okay, so you want to lean your body weight slightly forward, so that if you do slip like this, you see, if you slip like this, you're not going to slip away from the spine. Okay, and you're not going to slip onto the spine. So Dylan's back is hard as a rock, which is why he's having these lower back problems. I'm just going to press. Okay, so once you're done with all this, I'm going to speed this up. So basically you're going to be using both and pressing and moving up and down, just inching up and down like this. Or you can really use your elbow and dig in like this. Small controlled side to side movements. Okay, once again, if you go too much, you will slip and really cause the person a lot of pain, so really try to avoid that. Stabilize yourself, make sure your whole body is stable, and then you can go side to side. So same for the other side, really applying pressure downwards. Ah, it's really hard like a rock. And be really careful not to injure the person. Okay, so now the second part we're gonna hit the glute medius, okay? And I'm gonna flash a picture of the anatomy of your glutes or your butt over here on the side. As you guys can see, the highlighted portion is the part that you want to be applying pressure on and not the areas around it. Of course, applying some manual pressures to the areas around it will give you some relief, but not for your lower back, okay? So you really want to focus on the glute medius. So showing you from my friend's glutes over here, alright? Once again, locating the hip bone. So the hip bone is that bony curve at the top, okay, your iliac crest. And you want to find it, and you want to go slightly below. So his iliac crest is right here, okay? So you want to go below it, so right here, okay? This is part. So you're not, if this is the glute, you're not going at the top, you're not going here, you're going right by the side, okay? So the person can either be lying downwards like this, or it can be lying sideways, okay? So I prefer if the person is lying sideways, then you can apply pressure with gravity, so it's not so tiring. So can you please lean over to either side? Okay, and now zooming in the camera for you guys. We can really see. Okay, so once again, finding his hip bone, so the whole bone is here, going right below that, here. So it's going to take a bit of experience to find the glute, but I can already, using my hands, I can feel the muscle fiber of the glute here. And then I'm going to press down. Like this. Yeah, and he's like writhing underneath me. But basically, I'm just, again, same principle, press down, apply pressure, but don't move first. And then when the person can tahan, can really bear the pain, you press harder. And then after that, moving on to slight motions side to side. Okay. So if the muscle belly is going like this, alright, you want to be going against it like that. You want to be moving up and down, not along the length of it. Okay, so up and down like this. So the glute medius is kind of attaching this way, so I'm going against it, perpendicular to it, like this. Yep, I'm definitely feeling it right here.
Oh man.
Hang in there, man. Okay, let's relieve him of this pain and let's move on to the next one.
Oh boy.
Okay, so what happens if you don't have someone else to press these muscle groups? Then you have to really apply this manual pressure yourself, and you can do this by either having a really hard ball. You can use a lacrosse ball, a cricket ball, or you can buy from Decathlon one of those really hard balls and use it to really put in the pressure. Or you can use something as simple as a pebble. So I believe we have a rock somewhere around.
Yeah, Rocky.
Okay, so here we have a pebble. Okay, this is the cheapest solution, and you can find a pebble anywhere. Alright, so use the pebble, the sharp end of the pebble, okay, not the flat end. Imagine this as the elbow, okay, like this, and you want to be lying on the ground and digging into the muscle group. You have to use one hand to stabilize this because it can be really dangerous, especially for the lower back. If this is your lower back muscle and your spine is right next to it, if you let it slip, that's going to be slightly dangerous. So you have to anchor it with your hand underneath, and I will demonstrate that in a second. Okay, so lying down on the bench with my pebble. Okay, I'm going to put this way. See, like this. I'm going to put this like that under my back, finding the muscle and lying down and holding it there. So you keep your hand there so that you don't let it slip. And I'm feeling a very nice pressure onto my lower back. I guess it's nice if your lower back is not too tight, but it won't be very pleasant if your back is very, very tight. So just lean your body weight down, just like that. Okay, so I don't recommend you using a foam roller. Sometimes when I'm desperate enough and I don't have even a pebble, I can use my foam roller, the round long tube. But it's not ideal because it doesn't really put enough pressure. So pressure is when there's a small surface area and more force, right? So with that foam roller, is your pressure is spread out over that bigger surface area, so it's not as effective. So you want to find something small, a hard ball, a hard rock. Okay, so now we move on to the next one where we do this for the glutes. Okay, so now same thing, lying down sideways like this. Alright, I'm going to put the rock, find my glute medius, so I already know where my glute medius is. It's going to be right here. So it's usually where your pants line is, just slightly underneath. Okay, here, and okay, this time I'm going to move my hand away so you can see. Can you see the rock?
Yep.
Yeah. So the rock is there. Now I put my hand there and I lie sideways and stabilize. Yeah. So if you can move out a little bit and let them see my entire body posture. Yeah, you can see my legs are stable and I'm feeling that, oh yeah, very good pressure on the glute medius. Right there. Okay, so now that you're done using your manual pressure, now we move on to stretching the muscles. Okay, so usually I like to do the manual pressure first, then I'll do the stretching. Okay, so with the stretching, we start with the same sequence. We address the lower back first. Okay, so now I'm going to show you guys how I would like someone to stretch their lower back, and I think this is really effective. Okay, so I'll be showing you guys on the floor, starting out in a position like this, where you have one leg tucked in, one leg tucked out. Okay, you're going to be reaching over to the opposite side with your extended leg. So exactly like this. And if you have someone to help you, you can actually get them to help you push gently, apply pressure. And where you should be feeling the stretch is right here. Okay, and if you are tight, you will feel it right here. You will feel it in your hamstrings. Now what happens, I have people, even him before this, okay, when he tried to stretch and then you try to stretch and then all you could do was something like this. Literally he's stuck in this position because his hamstring is too tight, his back is too tight. Okay, so what you can do is you can actually tuck in that leg. Okay, just fold it in front of you, tuck in like that, and then you can lean over, and then lean to the other side, to the right side, and then you can stretch the lower back. But if you have hamstring tightness, you're going to want to solve that too, because it's going to cause you so many other problems. So try to add in your hamstring stretch as well. But if you really cannot, you need to start somewhere, start here. So as you can see, he's nice and lean forward. So I can actually just add some extra pressure, just push a little bit. And can you feel the extra stretch here?
Yes.
Yeah. So this is really good for the lower back. Okay, and then you want to do it for both sides. So changing over to the other side, like this. Make sure you're adding that twist to your body like this. So if you're flattened out like this, you won't really feel it. You feel it very central. If you're twisting like this, you'll feel right here in the lower back. Okay, pushing forward a little bit. Perfect. Alright, great. So lower back done. Remember to hold each stretch, okay, in all my stretching videos, and you guys can check it out up here. Okay, but all my stretching videos, I always emphasize that quality is really important. So you have to really breathe out and relax through the stretch. And very important, you have to hold it for at least 60 seconds. Okay, so many times when I tell people to stretch, what they do is they stretch for like 15 seconds or even less. Maybe they do like stretch, okay, stop. And that's not going to do anything good for you. Okay, you can ask any physiotherapist out there. You have to hold the stretch at least one, and that's even a very low cut off. Hold it for 1 to 2 minutes. Alright, okay, so next we're going to stretch the glutes. Okay, now the second stretch is the glute stretch, and it's very simple. With one leg sticking out like this, the other leg you want to bring it over and you want to hug in your leg. Okay, and some people, you might have this problem where your stomach is blocking you, and there's really no shame in that. Okay, don't laugh, but your stomach might be blocking you, it's fine. So the objective, right, so let's say your stomach is blocking you, your legs slightly more out here, right? How do you improve that stretch? Maybe you're not really feeling it here. You want to pull your leg to this side. Okay, so if he has left leg sticking out, you want to pull it to your left side. So if you pull it, just pull it in a little bit more. Do you feel the additional stretch? Even though you can't come any closer, right? So okay, now pull it into your chest. Imagine you can come all the way in. So you want to pull it back towards yourself, and you want to pull it to the opposite side. Okay, and you'll be feeling, so okay, if you just relax, so you'll be feeling the stretch on the other side. Okay, now I'm just illustrating here, but okay, if you're stretching here, if you're stretching the left leg, you'll be feeling it on the left glute right here. Okay. So some people tell me that what they feel, right, is actually they're feeling a tension right here. Okay, so if you can move your hand away a bit, sorry. Right here at your hips. And that's because, you know why? Your hip flexor is so tight that when you pull your leg together, all the whole muscle is bunched up right there, and you think, oh, something's wrong there. Okay, so that's going to be addressed in the next stretch. Okay, but first do this one. And how long do you have to do this stretch? Correct, yes, at least 1 minute. Okay, so let's move on to the third and final stretch. Okay, so what's the final one? Remember, it's the hip flexors. The hip flexors, once again, is the muscle right at the hip here, the one that helps you to raise up your hip into like a kneeling position like this. Okay, so how do we stretch this muscle? So the muscle is running from your hips, from somewhere in your back down into your leg. Okay, so it's coming here. We want to lengthen the muscle. So we have one leg here, straighten out like this, the other leg like that. Okay, I think words are making it a bit complicated, so you guys just observe his form, his body position here. Okay, and what you want to do is you're gonna bring your body forward. And okay, so what he's doing is exactly wrong. You want to stay upright, and you want to shift your center of gravity forward, like that. And you feel the stretch now, right? Because you're lengthening here. So as you can see, he's not leaning forward. I don't want you guys to lean forward. You guys are supposed to shift your center of gravity forward. Let's try that again. Let's show them. So everything here, all you're doing is just your hips moving forward like this. Okay, and let's show them the wrong example again. So leaning forward like that, that's not going to do anything for hip flexors. Okay, so up like this, shift your center of gravity forward. Basically your knee stays here, but your hips move forward, and it's going to stretch your hip flexors. You're going to really feel a really nice stretch here. Okay, how can you feel this stretch more? Okay, from a normal neutral position, let's shift your center of gravity forward again. Okay, as you can see, he's having his hands on his knees, which is totally fine. Okay, if you need to lean on your leg to balance at first, it's fine. But to up the level, what you do is lift up this hand above your body, just the left hand, up and above, up, behind. No, just straighten your arm, lean back. Oh yeah, oh, lifting it up. You can feel the stretch here and a bit of obliques if your obliques are tight, which, come on, most people's obliques will be tight. Okay, and if you are really want one more level up, what you can do is lean back and not too much. This is the most you should go. Okay, I don't want you guys to, okay, lean back even more. I don't want you guys to do this, okay, that might injure your lower back. So just lean back slightly. You can see just a very slight lean. Now go to your right. Yeah, and back. So there we go. And then you get the most stretch in your hip flexors right here. Okay? So as usual, let's repeat this. How long should you hold this stretch?
1 to 2 minutes.
Perfect. Okay, hold it for 1 to 2 minutes. Do it for both sides, and then there you go. Okay, so Dylan just reminded me of a really important thing. When you're doing this stretch, some people might feel like your knee hurts because you're putting your weight through a knee. How can you solve this? Very simple. Add a pillow, add a yoga mat, whatever it is. Just add some sort of cushioning right below your knee so that it doesn't hurt as you're stretching. Remember, when you're holding this position for a very long time, you have to really try to optimize your comfort, even though it's uncomfortable. Okay, so things like adding cushions or whatever might help you in this stretching. Alright, okay, so well, we're more or less done with all these stretches and the manual therapy. So after all this, Dylan, how does your back feel?
Painful.
Your back? Okay, it's still a little sore in the area, but definitely
Feel loose though.
you feel that release.
It's like a way lighter than before, man.
Yeah, okay, and I didn't pay him to say all these, okay? So these ones really are gonna help you a lot. And so I really hope that you guys will try this out for yourself. And if you guys know someone who's suffering from lower back pain, send this video to them, ask them to try it out, and let me know how it goes. Guys, I really get so much pleasure from helping you guys either get more muscle, lose weight, or really relieve these pains. Okay, so I'll be really happy to hear all your success stories once you try this out. I've tried this on so many of my clients, and trust me, they have had great results. Even him, I've been helping him manually release his low back for a few weeks now, and I think,
Yep, way better now.
Yeah, better. Of course, it's not perfect, but it's much better than it was before. Okay, guys. So I hope that you guys found this video useful. If you did, give it a drop a like below and drop some comments right below. All right. So with that, I'll see you guys in the next one.